Hi, and welcome to the June 27th, 2012 Plastic and Reconstructive and Cosmetic Surgery Journal Club. I'm Damien Marici, consultant plastic surgeon, and this is Dr. Siva Sathasivam, who is one of the plastic surgery registrars who has just finished his exam and will be a consultant plastic surgeon next year. So, as usual, we did 3 current papers and 1 classic paper. Siva, what was the first paper we looked at today?
Well, the first paper we looked at, Damien, was looking at the rupture rates of PIP implants. It was a paper by a Netherlands group, and they looked at it in light of the new controversies related to industrial-grade silicone and a high rupture rate for silicone implants.
Yeah. Now, what did people think about this paper?
Well, the paper, most people thought it was important because of the recent controversies and the huge uproar that's created in the media. But the purpose of the paper was not clearly defined.
But certainly, I mean, their finding of a 33% per patient implant rupture is highly significant, given that these implants were filled with industrial grade rather than medical grade silicone. That seemed to me quite an important finding. One of the things which I didn't understand and they didn't really go through in the paper is obviously the shell of the implant is the thing failing, and that would seem to be a separate device to what the shell is filled with, the actual industrial grade silicone. They did make a point that this rupture rate was comparable with rupture rates of similar aged implants. Is that your understanding?
That's right, yeah. So the conclusion that they came out with those 2 separate issues is that the known use of poor grade silicone for breast implants did not increase the rupture rate. It was slightly higher even before they started using the industrial grade silicone.
Right. How did people think the paper could have been improved, or what features of the paper were people?
Well, not having a control group is one thing, and it's really hard to get data on the side effects or the adverse health outcomes by using a non-approved grade of silicone.
Right. Okay. And then we also talked about the discussion paper, which was written by Hammond from the US, which was also an interesting review. All right, the second paper which we discussed was Simplifying Cheek Reconstruction, a review of over 400 cases. We also looked at the discussion. That paper was from Rapstein et al. From the University of Texas Southwestern and is in the current PRS. What did people think about this paper and the discussion of this paper?
Most people thought the algorithm presented by the author was not useful. So
why was that?
It didn't really give directions. It didn't correlate to the zones which were described in the article, but wasn't related to the results. And the large majority of cheek reconstruction defects were closed by primarily greater than 60%. So it wasn't a useful algorithm, but everyone does appreciate seeing a senior author publish his work and his results.
One of the things which was brought up by the senior members here at the Journal Club was saying they have no qualms in using Vita Y flaps on the cheek, although that was something that both Thornton and also Menick in his discussion were sort of against. They were against the small geometric flaps, which I assume would also include rhomboid flaps, but certainly that's something many of us use in our practice. Both papers were very much in favour of cervicofacial flaps, the main paper and also the discussion paper. The difference being that Menick in the discussion paper was in favour of bony anchoring and also a sub-SMAS dissection. Was there anything else about that paper do you think we should talk about?
Just reiterating the point, the VY flap was favoured when it laid in the nasolabial fold, but otherwise other rhombic flaps both authors disagreed on.
Okay. The next one we looked at was the classic paper. This was by Sam Hammer, Arcus marginalis release and orbital flap preservation in midfacial rejuvenation. This classic paper was from 1994 PRS and looked at a technique for lower blepharoplasty whereby the arcus marginalis was released with redraping of fat over the orbital rim. And that occurred from the 5 o'clock to 9 o'clock position on the lower orbital rim. And this was discussed in continuity with a current paper by Mendelssohn, or Wong et al., but Mendelssohn was a senior author, also in PRS, but this was the current PRS, looking at the tear-trough ligament, anatomical basis of the tear-trough deformity, and discussion. So what do people think about these two papers?
Well, I was surprised to find that there was controversy in regards to releasing the post-septal fat to try to camouflage the more visible infraorbital rim in aging. So I thought Sam Hammer's paper would have been widely accepted and practiced, but that was a surprise to me.
Yeah, certainly there is a huge variability in what people do in lower blepharoplasty. For example, Mendelssohn, the senior author in the tear-trough ligament paper, is in favour of a plication tightening of the orbital septum, whereas many other surgeons are in favour of a release of the arcus marginalis with using that fat in order to camouflage the orbital rim and minimising the removal of fat, of the post-septal fat. The tear-trough ligament paper described a new anatomical structure, being the tear-trough ligament, and it was advised that in order to correct the tear-trough deformity, this ligament needed to be widely released. I think people thought these were both excellent. Both these papers were excellent for different reasons. One's an anatomical paper, which hopefully will guide correction of the tear-trough deformity, whereas the other one is a classic paper describing a very commonly practiced surgical technique. I don't think there were too many sort of criticisms of either paper per se.
No, that would be fair to say. The anatomical study was meticulously done.
Yeah.
It was, as surgeons, we all appreciated the amount of effort, and it's nice to see that new anatomical findings can still be found in this day and age.
Okay. Well, that's the end of the June 27, 2012 discussion of the Plastic, Reconstructive and Cosmetic Surgery Journal Club. For those of you who were there, thanks for being there. And for those of you who weren't, thanks for listening.